In this video, I'm going to talk to you about how to control emotions. As a psychiatrist, it's incredibly important for me to know how to manage my own emotions because so many times patients will come to me in a clinic and they'll have anger, they'll have frustration, they'll have depression, and they often project those feelings onto me. And so I will often act as like a container that handles some of these negative emotions that they're experiencing, and I need to learn how to process it and handle it myself. So not to mention that it's important to handle as a psychiatrist, but also just in everyday relationships. In our brains, we have these things called mirror neurons, and mirror neurons basically can make someone mimic or imitate the behaviors that they're seeing from others, including the people in their own social connections or circles. So on one hand, it can help us to empathize with other pain and frustrations that people are going through. On the other hand, it can help us also feel some of their emotions and stuff that they're going through. So really, the people around us can have a big role on how we're dealing with our emotions. So many ways to handle it, and this video is going to talk to you about some of those ways, including some of the anatomical and physiological ways in our brains that may influence our emotions. So the anatomy behind emotions is quite interesting and quite complicated. So we don't know exactly what all the parts do. It originates in deep structures of the brain called the limbic system. And this limbic system in itself has a few different parts that all work together and communicate with each other to help with emotion processing and how one deals with their emotions. There's regions like the hippocampus. The hippocampus is important for storing short-term memories. There's a region called the amygdala, and the amygdala helps us to sense stimuli, and it helps form our perceptions of what's happening in our environment. And it's also these structures that help signal fear or anxiety and panic in our brains, which communicates with the rest of our bodies, which I'll explain a little bit more in detail soon. There's the hypothalamus. And the hypothalamus helps regulate some of the brain functions such as body temperature, blood pressure, hunger, thirst, energy, function of the digestive tract, just to name a few. Also, it's thought that the nucleus accumbens makes part of this limbic system. The nucleus accumbens is known for the reward center of the brain. So that's where we get this sense of feeling pleasure or reward and helps with motivation. There's also the thalamus, which is like a relay center for sensory information, which it senses from like our vision or our taste or touch, sound. And then all these communicate with different parts of the brain, in particular the front part of the brain. And the front part deals with like planning, organizing, and we can use our front part of the brain to help control or regulate our emotions. There's also several hormones or neurotransmitters that are involved that play a role in these emotions, and that will, a lot of the psychiatric medications that are used help target these hormones. So there's molecules like serotonin, which help keeps the body sort of calm, and a lot of medications that treat anxiety and depression work on this molecule. Also norepinephrine, which gives us that adrenaline response or that fight or flight response. Also, a lot of the psychiatric medications work on this molecule. There's dopamine, which is like the reward chemical or reward pleasure, where often we'll communicate with the nucleus accumbens, which gives us that sense of pleasure or reward or feeling good. And then there's molecules like acetylcholine, which are especially important in memory. And it's thought that this neurotransmitter deteriorated in cases of like a dementia. One of the main components of the physiology behind the emotions is the hypothalamus, because this secretes to the pituitary gland, which secretes several other hormones to various glands that go throughout the body. It secretes hormones to the thyroid gland, so it affects thyroid function, which can help with heart rate, metabolism, energy, things like that. Also, it helps signal the adrenal gland, which is cortisol is secreted from, and this leads to the stress response. So you can see a lot of the emotional center from the brain will signal this cascade of events. And so it's incredibly important to make sure that we have our emotions in check and we don't let the emotions that we have get the best of us or get a hold of us. You know, so many times people can react on the emotions and can really impact their functioning in life, whether it's their relationships with other people or with work or with their ability to function. So furthermore, I mentioned that the hippocampus helps store short-term memories, but that's where short-term memories or memories are initially stored. And then after a period of time, if it's something that we store in our long-term memories, it's going to be stored probably in other parts of the brain, like other parts of the cortex. So it moves to various other parts of the brain. And then as I mentioned, this nucleus accumbens deals with this like the reward or pleasure, and dopamine is the main molecule that deals with this area. So we can have important clinical diseases from dysregulation of the center. For example, people that enjoy certain chemicals or certain things too much, maybe it's smoking, maybe it's alcohol, this can lead to too much activation of this nucleus accumbens pathway. And that's essentially how people can get addicted, because they get so much pleasure or high to this chemical that this chemical then shoots up to the front part of their brain, and they deal with a lot of their life focusing on getting this substance, planning activities to get it. And for some people, it can just take over their lives. In people with diseases like schizophrenia is at least 6 months with psychotic symptoms. They are found to have brain changes and that they have less activity in their brain. So they may not respond at all to emotions or to things around them as much as like a normal person would. In cases of post-traumatic stress disorder, one way to think of post-traumatic stress disorder is this heightened state of the hypoathalamic-pituitary adrenal axis, which is also this fight or flight response. So basically they're always on guard, always watching their back, get very suspicious, anxious. They can get severe mood changes where it's very depressed or very angry. It's almost like this hypothalamic-pituitary adrenal axis is overactive, or it gets activated too easily or too quickly. Sometimes when this hypothalamic-pituitary adrenal axis is too active or not active enough, either extremes, that can lead to depression because the body likes to be in the state of balance. And over time, it will regulate itself in that state of balance, but in clinical diseases or clinical scenarios like a clinical depression, this equilibrium can be out of balance and it needs help from a medical professional to make it more in balance, at least more quickly. Also, too much cortisol or too much stress can lead to anxiety. Or if there's a strong emotional response, sometimes it can lead to heart attacks or a burst in the brain that leads to like something like a stroke. There's also certain syndromes where people can get damage to certain parts of the emotional center, like certain damage to the amygdala can lead to a condition called kluver-bucy syndrome. And this can happen in cases of head injuries or strokes where people may get overly sexual, then maybe they put a lot of objects in their mouth. So how do we control these emotions, and how do we control this brain activation pathway that communicates with all each other? Well, it can be simple yet complicated at the same time. There's a few different approaches you can look at. If things start with the amygdala and deep down in those structures, oftentimes the emotions and the emotional center can hijack our thinking. So it makes it more difficult for us to do the things that we want to do because our emotions are too high or too strong. And this is one of the ways that therapy can be so helpful, is that we use parts of our brain like that deal with thinking and planning, and we try to correct the way we're thinking, because our thoughts affect our emotions, which can affect our actions, and that's all sort of related. And so we use our thinking part of the brain, our frontal lobes, to help talk down our emotional center, to help calm us down if we're being too active. Or if we think positive and good thoughts and grateful thoughts, that is more likely to going to lead to positive, grateful emotions and things like that. Conversely, if we think more negative thoughts, more anxious thoughts, more depressing thoughts, what we think tends to grow. So we really have to challenge the way we're thinking. Where does medications come in this route? Well, if the emotional center is too active or too strong and it's hard to control or redirect it, medications can help to calm that part of the brain down. There can be medications used for depression that can help decrease the depressive symptoms one may be feeling or the anxiety feelings one may have. In cases of post-traumatic stress disorder, there can be medications that help decrease that on-guard response that people may get or the anger response people can get. Medications can have their side effects, and if it's possible to address it in other ways, by all means, that's often great and encouraged. but there's definitely certain times where medications are helpful and necessary. So some roles that psychotherapy can help with is the patient just releases all their emotions and thoughts and feelings onto the therapist. And the therapist there is supposed to act non-judgmentally, just kind of listen to what the patient is saying, maybe summarize, maybe help them see things in different perspectives. And the therapist often acts like a mirror in helping the patient themselves reach their own conclusions. Sometimes therapists can go through guided relaxation techniques like deep breathing. And deep breathing basically will try to switch the nervous system response in the body from the fight or flight response to the relaxation response. So when you take deep breaths, that can slow down the heart rate, can slow down the breathing. And so it tries to be an intentional way to switch the activation response, or this hypothalamic-pituitary adrenal axis response. Now, self-care is an important aspect of helping to manage emotions, including eating healthy, getting adequate sleep, exercise. Eating healthy alone can help us to decrease some of the psychological symptoms someone might have. Sleeping well can help us to feel better, boost our mood, and decrease also some of the negative emotions we may be experiencing. Exercise in itself can sort of act as an antidepressant and help manage stress, and can help to naturally increase some of the endorphins that help us feel good and help with our emotional state. Now, lastly, I want to talk a little bit about a spiritual approach that can help manage emotions. One principle that has been taught for thousands of years is fasting. And one of the principles behind fasting is that if we can control ourselves from certain foods or certain drink, I have more detailed videos about this, which you can refer to for more information. But fasting can be a tool that can help us to regulate our emotions, help us to have self-control. Because the principle is, if we can control ourselves over food and drink, then we can also help control ourselves over certain thoughts or emotions that one may have. And then also, if you take a look at the spiritual approach, then from a Christian perspective, at least, you will be aware that there's always this constant fight from the devil. And one quote that came recently that helps to put things into perspective, why to not let your emotions get the best of you, is this quote from Elder Ephraim of Arizona. To be honest, I don't know exactly who he is, but this quote has a nice contemplation about this. He says, "When you are happy, you should conceal it within yourself so that he, Satan, does not discover it through your carelessness and rob you of it with some temptation. Likewise, when you are sad, do not let it show, lest he, Satan, augments your grief after discerning the reason for your sadness. If you maintain a balanced state when you are happy and when you are sad, the devil does not know exactly what is happening inside you, and thus does not know how to fight you." So in other words, he's saying, if we let our emotions show too much, the devil is going to try to fight us based on what the devil sees. So in other words, the devil is looking at us from the outside, but we can look at ourselves from the inside and hopefully be guided by the Holy Spirit through the inside to help protect us from the devil and Satan trying to basically ruin our lives. Lastly, prayer can help to redirect our thoughts or emotions and give it to God. One of the things about the Bible that helps us to see this is the Psalms, where the Psalms have people from the Bible express their thoughts and emotions to God and cast it to God. And oftentimes, when you cast your thoughts and emotions to God, it will help see things in a positive light and help trust that God is going to help and provide at the right time. Hopefully this gives some insight into how to control emotions. There's several medication classes that are often prescribed to help address emotions, whether it's selective serotonin reuptake inhibitors, there's mood stabilizing medications, even antipsychotic medications can help. If you are interested in medications, be sure to talk to your medical doctor or mental health professional about ways to go about prescribing this or about going about this. And I have several videos about different types of medications that can help with various emotions. If you like this video, be sure to like the video to let me know. Subscribe to the channel for more videos like this one, and leave a comment or so if there's any other video or topic you'd like to address.